Hello everyone. Hope you're well. Today we are going to talk about healthcare system and what do we mean by healthcare system when we use these terminologies. So if you haven't already, please do like the video and subscribe to the channel. I think it is important for us to understand what do we mean by healthcare before we talk about healthcare systems. By healthcare, we means the maintenance or improvement of health by the prevention, diagnosis, treatment, recovery, or cure of disease, illness, injury, and any other physical and mental impairments in people. So basically, it is making sure that people are living healthy and their health is protected. And the activities or the system or the organization or the people who enable provision of those services which enable people to stay healthy, protect themselves from disease, and provide them cure when they have some kind of disease is called a healthcare system. So a system consisting of all organizations, people, and actions whose primary intent is to promote, restore, or maintain health, which includes efforts to influence wider determinants of health as well as more direct health improving activities. So it's everything that we do to make sure that people are able to live healthy, and that's called the healthcare system. A health system is therefore more than the pyramid of publicly owned facilities that deliver personal health services. So with what this means is the WHO saying that it's not about the buildings or the organization or the facilities which are publicly owned and are available, but it is everything that is that makes sure that people are living a healthy life. So it is the doctors and nurses who are working across it. It is the health awareness programs that are done to ensure that people are able to bring changes to their behavior and live a healthy life. Exercise facilities where people are going and doing some kind of activities. And many other activities that are there to ensure that people are living a healthy life. Why do we need a healthcare system? Well, because we want to make sure that people are able to live a healthy life and their health is improved. There is less disease in the community, in the country, for the individual that we are catering for. We want to protect people from financial consequences of ill health when they get ill, because there is some kind of system which helps them receive the services and not be out of pocket or not be completely swamped by the expenses of healthcare. And we would want to make sure that equity is promoted into the society and people are treated equally and people are treated equitably in terms of the services. And that's where a healthcare system is needed, so that people who need healthcare services are treated effectively, equitably, and properly. So the World Health Organization has provided as framework, which says that there are various building blocks in a healthcare system. And these are 6 blocks, which include service delivery, health workforce, so service delivery, all those activities that we perform to ensure that the services are delivered to individuals at their doorsteps, in the hospitals, in the primary care, in the secondary care, wherever it could be. Healthcare workforce is the people who enable delivery of services. So it include doctors, nurses, other healthcare providers in depending on wherever we are talking about, and all those people who enable provision of healthcare services. Information systems is the sum of the how we collect the information, not only about the patient who we serve, not only about kind of trying to understand how we are providing services, but to understand what is happening into the community, what is happening. So COVID-19 probably is a very good example that how we collected information throughout that time period to understand how the COVID-19 was spreading, who it was affecting, how vaccine would develop, how, where the vaccine is working, who is getting affected by it and not. So if we didn't have that kind of organized information system, we would not have been able to understand the effectiveness of the vaccination, the effectiveness of the program, and the problems that people are suffering due to COVID-19 or for any other healthcare problems for that matter. Medical products, vaccines, and technologies is another building block, in which we want to make sure that there is provision of medicine for all those who need it. The medicine is kind of the cost element of the medicine is probably looked into, and people are not really affected. People are provided with appropriate vaccination, appropriate technologies, and appropriate medical products when it's needed. Financing is about how the healthcare system is financed, where the money is coming from, how it is affecting people who are going through it, and all that related aspects around it. And leadership and governance, of course, no organization or system can work if there is not effective leader who is able to run the organization, provide a vision to the people who they are working with, provide a mission to the organization, and make sure that people are working strategically to achieve the aims and objectives of the organization. Leaders also help people understand the importance of the work which they are doing and enthuse the courage and enthuse the encouragement to work on the goals of the organization as well as for other people. So all these 6 building blocks together have an effect on the achievement of overall aims and objectives, which includes that we want to make sure that health is improved and equitably services are provided to people. We want to make sure that it's responsive. We want to make sure that people are not affected negatively, and there is a social and financial risk protection around different problems. And we want to make sure that efficiency is improved of the services that we provide to people. So these are the 6 building blocks that WHO has proposed, and they are the components of any healthcare system. And I thought it's easier to understand it that way. So here, while it says service delivery, but all of these aspects are related to various different points that we have talked about.